Hey, this is Dr. Berry. In this video, I want to issue a warning to all type 2 diabetics in the US, Canada, Australia, and the UK. I've been beating around the bush about this for a while, and I keep going back and rereading the American Diabetic Association guidelines. I keep looking at the products the ADA puts their stamp of approval on, and I really can't beat around the bush any longer. So I'm going to issue this warning to diabetics about the ADA guidelines and the ADA recommendations for what you should eat. Now, here's the problem. The ADA has been in charge of taking care of diabetes in America for the last few decades, and diabetes has only gotten worse during their tenure. And so I think it's time for someone else to take over care of diabetics in the US and de facto in the rest of the world because the ADA is doing a terrible job. The American Medical Association published a figure a few years back that 52.3% of US adults are either diabetic or pre-diabetic. That's right. More than half of US adults are either diabetic or pre-diabetic. Think about that. In America, in the US, it's now normal to be pre-diabetic or a diabetic if you're an adult. Does anybody have a problem with that except me? I think that's a huge problem. I think the ADA has failed diabetics. I think they failed America. I think they failed the world. And I think they need to back away from giving guidelines and recommendations about diabetes and the foods that diabetics should and should not eat. And I think that should start today. And so I'm not going to keep quiet about this anymore. I'm speaking out, and I hope that the rest of you join me. If you know a diabetic, a pre-diabetic, an insulin-resistant person, someone with type 2 diabetes, please share this video with them on their Facebook. Put it on your Facebook. Share it in your diabetes groups. Share it every way you know how, because there are so many diabetics in the U.S., more than half of adults, who are suffering and can't figure out how to get their diabetes under control, who are losing legs, who are losing their vision, people who are losing their mom and dad's life. They're losing family members because of the egregious recommendations of the American Diabetic Association. Now, let's talk about the guidelines. The American Diabetic Association has been putting out annual guidelines and standard of care for every year now for years and years. Doctors and nurse practitioners and physician's assistants and diabetic educators use these guidelines to then educate diabetics on how they should eat and what they shouldn't eat, what they should avoid, foods that they should eat and foods they shouldn't eat. These guidelines also talk about medications. They talk about giving insulin to type 2 diabetics. These guidelines have only been making diabetes worse in the US. And so it's time for all doctors and other providers and practitioners to start ignoring these guidelines if you actually care about your diabetic patients. I think that's what we all should do. So these guidelines recommend that you eat whole grains, that you drink fruit juices, that you eat lots of fruit. And so we all need to come back to the realization of what causes blood sugar to go up. If you eat fat, does your blood sugar go up? And every diabetic out there is going, no, it doesn't go up if you eat fat. If you eat bacon, if you eat egg yolks, if you eat pork chop, ribeye, it doesn't make your blood sugar go up at all, right? If you eat a lot of protein, your blood sugar might go up a little, but it's not a big deal at all. What makes your blood sugar go up? And a lot of people are saying, oh, sugar. Yeah, that's right. Sugar is, but sugar's a carb. Yeah, sugar does make it go up almost faster than anything, well, except whole wheat bread. That makes it go up faster. Oh, and oatmeal. That makes it go up faster than sugar, too. But wait a minute, those are things that the ADA recommends that diabetics eat every day. Lots of servings of whole grain and oatmeal and fruits, but they're full of carbs. So carbs, that's what makes your blood sugar go up. Yet the American Diabetic Association's guidelines teach doctors and diabetic educators to teach our diabetic patients to eat lots of carbs. What do they actually say on one of their social media posts? They say the American Diabetic Association recommends that diabetics eat anywhere from 45 to 60 grams of carbs per meal and anywhere from 15 to 20 grams of carbs per snack. And so if the average diabetic has 3 meals and 2 snacks a day, which some have more than that, right? Then you're talking about 150 grams of carbs every single day, which is going to raise their A1C, raise their baseline blood sugar. It's going to increase their risk of retinopathy, of kidney failure, of liver failure, of obesity, of heart attack, of stroke, every chronic disease that a diabetic is at increased risk for. If they follow the American Diabetic Association guidelines to a T, it's going to increase the risk of having the very complications of diabetes that the A.D.A is supposed to be in charge of preventing. On the main page of the A.D.A website, it says, "Imagine a future without diabetes." Well, guess what? It ain't ever going to happen if you follow the A.D.A guidelines. Diabetes is only going to get worse. It's went from 20% of U.S. adults to 52.3% of USA adults, with the A.D.A being in charge of diabetic education. So I think that thanks a lot, A.D.A, but we'll take it from here. I don't think that the guidelines will ever make a meaningful change, and by meaningful I mean a good change. It's going to be a meaningful change. It's going to increase. Next year it'll be 53%. Next year it'll be 54% of U.S. adults will be pre-diabetic or diabetic. That's not my goal. My goal is to decrease that percentage and to decrease existing diabetics A1C. And in order to do that, you have to eat low carb. That's common sense. Carbs make your blood sugar go up. Eat low carb, your blood sugar will come down. The American Diabetic Association, they formally recommend 3 different diets. And I'm sure you're thinking, well, I'm sure those diets have just reams and reams of research backing them up as diabetic diets, right? These 3 diets are the Mediterranean diet, and the A.D.A is not talking about the real Mediterranean diet that's full of healthy fats. They're talking about a low-fat Mediterranean diet, which no Mediterranean I don't think ate in the past. They recommend the DASH diet, which is a low-salt diet that used to be recommended for people with high blood pressure, and they recommend plant-based diets. And I'm sure if you're the average American, you're thinking, well, the A.D.A wouldn't recommend those diets if there weren't just study after study, huge studies with thousands of people in them that they followed for years and years and years, and showed if you eat a plant-based diet, your A1C comes down, your risk of complications go down. So the DASH diet, that was for hypertensives, right? People with high blood pressure. I'm sure that they found, oh my gosh, look in this huge study with 100,000 people, it also lowered A1Cs. Yeah, so here's the problem with that. It's not your fault that you assume that, because that makes perfect sense. Because why would the A.D.A recommend a diet that has only a few short, very weakly done studies to back them up for diabetics? They wouldn't do that, would they? Well, actually, yes. Yes, that's exactly what they did. The Mediterranean diet, you've been hearing in the media recently about all the research on the Mediterranean diet was cherry picked and messed with and perhaps even fabricated. True Mediterraneans put butter on their butter, is what people who actually used to live there tell me. But yet the A.D.A wants to talk about a Mediterranean diet that's full of fruits and full of whole grains and devoid of saturated fat, even though that's not how true Mediterraneans eat. And so, but even the studies about the Mediterranean diet are very small and very short, maybe 10 weeks, 8 weeks, 12 weeks. There's no long-term study. There's not a single long-term, large, well-done study that shows that the Mediterranean diet is the diet that diabetics should eat. Yeah, you heard me. You heard me right. The DASH diet. There's not a single long-term, well-done, placebo-controlled trial that shows that the DASH diet is the best diet for diabetics. Not a single study. It's not there. You can look all day. And if you find one, please send it to me ASAP, because I'd love to read it, because I can't find it anywhere. And then the plant-based diets. I know that's very politically correct to say, oh, you should eat a vegetarian, vegan diet. But when you look at the research studies that the A.D.A actually put in their guidelines to support this, it's like a study of 31 people for 6 weeks, and it doesn't really show anything meaningful about lowering blood sugars or A1Cs, which is what we should be concerned about for a existing diabetic. Because when A1Cs are up, when blood sugars are up, that's when the complications happen, right? So I'm officially issuing this warning from me, a medical doctor, to beware of the American Diabetic Association guidelines. If you are being instructed as a diabetic on how to eat from a doctor or a diabetic educator, you need to ask them, did these guidelines that you're teaching me, did they come from the A.D.A? Because if they did, I don't want to use them, because obviously when people follow the A.D.A guidelines, their diabetes gets worse. I don't want that. If you see a product in the grocery that has the little A.D.A stamp of approval on it, you should avoid that product, because it's probably full of wheat and it's probably full of sorbitol, which is a sugar alcohol that immediately converts to sugar in your bloodstream and raises your blood sugar. It's been shown time and time again. So why is the A.D.A recommending these cookies that have flour and sorbitol? Why would they do that? And there are some people on the internet that even think that it's a conspiracy, that the A.D.A is trying, that they'll go out of business if there aren't a lot of diabetics, so they're trying to create more diabetics. I can't believe that that's true. But if you or I were to sit down and say, let's come up with a diet and guidelines that literally are the worst guidelines possible for diabetics, I think that our guidelines would be very close to the A.D.A guidelines. I think we would recommend high carb, lots of whole grains, lots of fruits, drink your fruit juice every day, eat lots of snacks so that you keep your insulin level really high, or take these medications that keep your insulin level high, or just shoot up with insulin every day. If you're a type 2 diabetic, that's what you should do. If I wanted to make a diabetic patient worse, that's what I would recommend. And I have to, in full disclosure, I have to tell you, I used to be that ignorant, uneducated, thoughtless doctor who recommended the American Diabetic Association diet guidelines for my diabetic patients. And I apologize for that. I know that I caused harm in those patients. I hope it wasn't too severe. I hope that I caught on soon enough that they weren't damaged too much. But I would like to issue this formal public apology to all my former and present diabetic patients. When I recommended that diet to you, I apologize. And that was basically malpractice on my part for recommending the A.D.A diet to my diabetic patients. Now, if you enjoy this video and you'd like to hear more like it, consider subscribing to this channel. There's a little subscribe button you can click and a little bell right beside it. If you click the bell, you'll get a notification every time I get a bright idea. If you are a diabetic and you have reaped benefits from watching my videos, if your A1C is now lower, if your blood sugar is lower, if you still have all 10 toes and you can still see out of both your eyes and you're not on dialysis, please consider clicking on my Patreon link down below. You can sign up very quickly and you can throw a buck or two my way so that I can make more videos just like this one to help even more people. I'm sure at some point I'm going to start getting kickback and lawsuits from the A.D.A and who knows who else for saying these things out loud as a medical doctor, but I can't sit by quietly anymore and watch diabetics suffer and die needlessly, die early deaths, terrible deaths, because they are honestly, faithfully, rationally listening to the American Diabetic Association. If you're a diabetic or a pre-diabetic, please stop listening to the A.D.A. Please stop buying products with the A.D.A symbol on them. And please start asking your doctor and your diabetic educator, are you educating me based on A.D.A guidelines? Because if they are, they need to stop. This is Dr. Berry. I'll see you next time.